The labrum is the cartilage that surrounds the hip socket. It may tear as a result of athletic injuries, falls, motor vehicle accidents, or arthritis. Patients with symptomatic tears should consider an arthroscopic repair. The surgeon begins by placing the affected leg in traction to create room between the ball and socket of the hip joint. A needle is placed inside the joint under X-ray guidance, and a guide wire is passed through the needle. The needle is removed and a metal dilator is passed over the guide wire to create a track into the hip. A small camera is then placed over the guide wire into the hip joint. The process is repeated to create a second access portal for the surgeon to perform the repair. A needle is placed anterior to the first in the hip joint and a guide wire passed over the needle. Two dilators are used to allow for passage of larger instruments. A tissue cutting instrument, or shaver, is passed into the joint over the guide wire. The shaver is used to create room in the lining of the joint for the easy passage of other instruments. A blade is then inserted through a cannula and is used to free the remaining labrum from the hip socket. Once the labrum is completely detached, the underlying bone is smoothed to allow for easy reattachment. A suture is then placed around the labrum and brought out the cannula. A punch hole is created just above the rim of the socket, and the suture is secured to the hole using a push-lock anchor. For larger tears, the surgeon will use multiple anchors.